about 10 years ago, the state of California, we had a discussion about whether we ought to collect data with regards to race and ethnicity. For those of you who remember Proposition 54, there were some in our state who did not think that it was important to know if African Americans got sickle cell anemia at higher rates than others, if Asian Americans got hepatitis B, or if, as Senator Manning pointed out, if Latino kids get diabetes. And knowing this information has saved lives. It has also allowed us to better target our scarce budget dollars and being smarter about how we move forward with things. I want to take a moment and reference, I know Mr. Tran talked about Assemblymember Bonta's AB 176 around disaggregating data regarding our API communities. Certainly I know Senator Wynn and I represent two facets of a very diverse API set of communities, and it's incredibly important for us to know this data.
The Institute's dedicated to conducting rigorous, independent research and scholarship on sexual orientation and gender identity, both law and public policy. Many of our prior reports have identified disparities among LGBT communities across many aspects of life. Our focus today is on the particular health disparities faced by LGBT-identified individuals in California. So a few quick facts. Previous research has identified the following health disparities among LGBT communities in California. Heterosexual adults are more likely to have health insurance coverage than LGB adults. LGB adults are more likely to delay or not seek medical care. LGB adults are more likely to have cancer. LGB youth are more likely to be threatened or injured with a weapon in school and are more likely to be in physical fights that require medical treatment. LGB adults are more likely to experience psychological distress, and LGB youth are much more likely to attempt suicide. Men who have sex with men continue to make up the largest transmission category among people living with HIV, and even more importantly, bringing in what former presenters indicated, there's an intersectionality at work here. African American communities, particularly, continue to be disproportionately impacted by HIV. And so that overlap there among MSM and Black MSM is clearly identified. Historically, there's been a lack of standardized measures to collect sexual orientation, gender identity information in federal and state surveys. California, compared to many other states, is ahead of the curve. The information we do have about LGBT populations is available in large part to the inclusion of sexual orientation measures in CHIS, the California Health Interview Survey, since 2001. Other surveys that have included sexual orientation measures include California Behavioral Risk Factor Survey, also known as the California Adult Tobacco Survey, and California Youth Risk Behavior Survey. More recently, the Williams Institute has successfully worked to add measurements for gender identity to CHIS, and has successfully fundraised to have this measure included in the next cycle. An additional measure for adolescents will also be included, asking about gender nonconformity. With the inclusion of the measurements, California will be the first state in the country to collect gender identity data in a population-based survey of its size. So what's missing? Well, collecting sexual orientation and gender identity, or SOGI data, the way we refer to it, is vital to understanding health disparities among LGB and particularly T populations. While we may have some data with regard to health and health outcomes, such as the information I shared with you before, what we do not have is data that describes the LGBT experience beyond that point. We remain unable to capture the LGBT experience with regard to service provision, and thus we're unable to assess the LGBT experience as it relates to accessing health care. And I believe Assemblymember David Chiu has introduced a bill this session to begin addressing this gap in data collection. And we just wanted to share today that based on our experience with both state and federal agencies in both making the case for data collection on SOGI measures and getting such measures included in large population-based surveys, we've found great success in creating and establishing ongoing collaboration with such agencies. And while you may be in the process here in California of identifying where inclusion of SOGI data measures makes most sense, we also urge you to think about the way in which survey questions could be made more appropriate for LGB populations. For example, language referring to a husband or wife may be better presented as a question about a spouse. In this way, data collection can be done in a way that no longer alienates LGBT community members, and it does not make it difficult to respond to such questions. We look forward to seeing how California continues to be a leader in this regard.
I did want to ask a question specifically around LGBT data. I want to thank Ms. Miyashita for her presentation from the Williams Institute. You talked about the limited amount of data with regards to our LGBT communities, and I was wondering first if you could just share a little bit more. We have some data, but we know there's so much more data that we'd like to capture. If you could give some examples of the sorts of data that would be helpful to obtain. And then if you could just talk about what would be the positive benefits of having this data. As you alluded to, I have introduced and I'm authoring a bill that would hopefully move forward more increased collection of data regarding our diverse LGBT communities. This is incredibly important, not just to, again, address the health and other social service needs of our diverse communities, but to ensure that, again, we're using our budget dollars as wisely and as efficiently as we can. But if you could take a moment to talk a little bit more about, again, how would this data help?
The data that we have so far in California is really limited to sexual orientation. What that leaves out is gender identity. And the reason why asking questions about gender identity and should know that some of the best measures, aren't one question. So it can be a little bit more complicated. There are best practices to this, but asking about gender identity is incredibly important to figure out who amongst us identifies as being a transgender. So for those of you that kind of are used to having the term LGBT run off and roll off your tongue, even us at the Institute, we feel that way as well. We're very cautious about when we say LGBT because the reality is that the data on T, the transgender community, still remains fairly minimal. Having the ability to expand the G, the gender identity component of SOGI, into a number of surveys has a lot of benefits. But number one is really just being able to capture who among us is identified as transgender. If California is able to add gender identity to its surveys, I mean, as I said earlier in my presentation, California will be the first state to be able to do so on a population-based survey. What that means is that we can make certain claims and we can look at that data and understand what's going on generally on a larger scale than just California. Now, there's some question about whether the findings of any California-based data could be representative of the nation, and I think that's still a question, but it would be the largest kind of population base from which we could gather that data. So it would help us to better understand the complexity and the diversity and the variation within the communities that we identify as LGBT.
Great, thank you. I just want to note two things. New York State has actually, at this moment, they are ahead of our state of California as far as the efforts that they have around data collection. So I am hopeful that our state will soon catch up. And then I wanted to just conclude by noting kids in LGBT families have poverty rates that are twice those of children in straight families. Hate crimes with regards to involving victims who were LGBT is the second most common type of hate crime, comprising of 25% of all hate crimes. And then certainly with regards to health disparities, the data that we do know shows that our LGBT families are at higher risk for cancer, mental illness, higher rates of smoking and substance abuse, and that's what we know. And we also know that there's a lot we don't know. So again, I want to thank you for your work and hope to continue this conversation, colleagues, on this topic.